Continuing my educational series on the Lindsay Clancy trial, I wanted to address medical documentation, kind of how people have been trained, and the pitfalls of medical documentation. As a reminder, this video series is intended to be educational, objective, and neutral. If I state anything that appears to be a fact, it's because that's something that was submitted as a fact during the testimonials of the witnesses. I'm not trying to take sides, I'm just trying to help address the overwhelming amount of misinformation that I've been seeing pop up on social media as this case continues. So to begin with, healthcare documentation is unique in that it's kind of trapped in a place where no matter how you document, you can never really be successful in a courtroom. Medical documentation has usually been intended to be a place for physicians to share pertinent positives and pertinent negatives of a patient encounter that they had. It was never intended to be a transcript. You'll usually find during court cases that defense attorneys act as though the medical documentation is inadequate because it's not a verbatim transcript of the encounter. Unfortunately, even if medical documentation was a verbatim transcript, we would still be left with situations where somebody could read every word of it and say, well, why didn't you ask about X, Y, and Z? The patient came in with left wrist pain. Why didn't you ask them how their right wrist was feeling? The patient came in because they were feeling depressed. Why didn't you ask them what their dog's stepson's name was? So there really is no way to win no matter how you document when it comes to a court case. So for all the people saying, oh, I would have documented differently, I would have said this, I would have said that, my documentation is more thorough, I regret to inform you that there really is no good way to completely protect yourself when a defense attorney takes a look at what exists in the medical records. I also want to add that medical documentation for physicians is pretty different from how medical documentation is for even other healthcare workers. Physicians have to see a lot of patients, and even with the huge amount of patients that they see, wait lists for specialties and appointments tend to be months long. Imagine you have a 20-minute appointment with a physician. They're usually already spending several hours each day after they're done with their shift documenting. If you want physicians to document in more detail, I think many people would literally cry from happiness to have twice as much time with their patients. However, an expected downside of that is then that 3-month follow-ups will become 6-month follow-ups, 6-month wait lists will become 12-month wait lists. Unfortunately, the system that we live in is not ideal, and I understand that, and I think that we can make changes and improvements to it every day for several lifetimes and still have a lot of room to go, but we still have to acknowledge the limitations of the system that we're in. The first portion is really just to talk about how there are a lot of issues and how documentation is expected to be done on the medical field as a way to communicate between other medical professionals, how it's viewed in a legal context. Ultimately, the things that people want a medical record to have isn't possible for any individual to provide in their documentation, and that's a barrier that we will always run up against. Lastly, I wanted to address the high level of controversy that came up when Dr. Tufts documented no rapid, pressured speech in one of her appointments with Lindsay Clancy. I, as a psychiatrist, immediately understood what she meant and was actually very surprised that the defense attorney made this to be an egregious mistake. I find that a lot of people were actually trained to document with that, and I actually still see all the time a lot of documentation like that. And part of that, again, is because medical documentation is used for healthcare professionals to communicate with each other, and there are ways of documenting that really only are understandable to us. Whether or not we should have several more hours a day to document in a way that will make the case understandable to a layperson on a jury during a court trial is a whole different matter. But personally for me, that is a very common thing that I see, and I knew exactly what she meant. And I feel it's very unfortunate that people are saying she should be put in prison for life or incarcerated, etc., because she documented in a way that's easily understandable to other psychiatrists.